You know, we hear it all the time. We have that one person in our life who tells us about how great and athletic and beautiful they were before that one injury that just put them out of commission, and all of that arthritis started happening either in an elbow, a knee, a hip, or their spine.
I used to be an adventurer like you. Then I took an arrow in the knee.
And so after a car accident, we start to wonder, is this it? Is it all downhill from here? And coming from someone who personally has gone through that twice in my life, I'm happy to say, no. You don't have to be stuck with arthritis, and there are plenty of things that you can do to avoid this seemingly inevitable aging process. So if you find yourself waking up every morning and every joint in your body is clicking and popping, and you're starting to wonder if that pain's going to be every day for the rest of your life, keep watching because this video's for you. Today, we're going to explain to you why arthritis isn't inherently inevitable. It can be avoided. Granted, over time, if you're lucky enough to live long enough, you are going to experience some bone remineralization, but that doesn't mean it has to be a bad thing. We're going to talk about how your cervical spine and your military neck, kind of how those muscles affect the architecture of the bones in your neck, can really contribute to the development of arthritis. And then a little bit of the anatomy, Wolff's Law and bone spurs, basically how your body responds to sustained pressures. We're going to go then into your body's physiological response to trauma, if it's a whiplash with a disc bulge, a herniation, or some sort of tearing of that soft tissue, where we can go to help reset and rebuild your cervical spine so that you don't develop this early onset arthritis. And then finally, following a trauma, whether you should be going to an MD or a chiropractor, physical therapist, massage therapist, so that you know the right steps to take based on the severity of your injury. To get started, we all have, or should have, what's called a cervical lordosis, which is a fancy way of saying a nice little curve in your neck. And why that matters is because when we look at the anatomy of a spine, we have these big chunky bits that look like plates, and then we have this spiky part in the back where all the muscles and tendons tend to attach to. And as you can imagine, the thick chunky parts are what are supposed to be the load-bearing area of the bone, whereas the spiky parts are meant to be points of attachment, points of motion, and also things that link together to make sure that your head doesn't just slip off. But the fun thing is that we can lose that cervical lordosis, and it doesn't have to be from a trauma. Traumas like whiplash cause all the muscles to kind of misfire, and so we get a tightening of all the muscles in our upper cervical spine, which then causes straightening of those bones. But you can also have this reversed in a death by 1,000 paper cuts sort of way from working at a desk or staring down at your phone 24/7. And what happens is we get a weakening of your deep cervical flexors, which help to pull your neck forward into that curve, and an over-tightening of your larger cervical muscles, mainly your upper traps, your scalenes, and your paracervical muscles posteriorly. And this results in the development of a column, also known as military neck. And where military neck becomes problematic is that when we lose that lordosis, we also lose our body's ability to absorb a lot of shock. And I don't mean shock as in surprise, I mean as in compressive pressure. So who cares? If we lose that curve and we have a straighter neck, maybe we'll be a little bit taller and we'll finally be allowed to ride those rides at Kennywood. But why this becomes a problem is because now that downward force of gravity on our head, and your head is about 10 to 15 pounds depending on your size, we then start getting increased pressure to the wrong spots of your spine. Meaning that regions that are meant to be weight-bearing aren't bearing as much of the load, and some of those regions that are meant to be more supportive and structural are taking on a lot more load. And that then feeds into Wolff's Law, which is a biological process in which tissues under pressure start to reinforce themselves. Wolff's Law pertains specifically to bone, but we've all experienced this. If you play an instrument, if you lift weights, if you work in the garden, anything that's hands-on, you get calluses because your soft hands are touching rough stuff and the skin cells become more dense, more capable of resisting cuts from that rough material. And calluses are good, right? Because they keep you from having gashes all over your hands, and if you play the guitar or you lift heavy things, having that soft hand is honestly very uncomfortable versus developing that callus, and you're better prepared for holding rough surfaces. So for a bone, this is really useful. If you're lifting heavy weight or even just the weight of your own skeleton, then what you're going to do is you're going to reinforce areas that have a lot of downward pressure on them, forming a kind of bone callus. This is awesome. This is your body's physiological response to pressure. But if that pressure is in the wrong spot, i.e. on the structural components, rather than the weight-bearing components of your spine, we start getting spurs. And spurs are essentially where your body's own healing process starts to go awry. Not because it's stupid, but because the pressure being sustained is in the areas where it shouldn't be. And your body is so proactive, it starts laying down calcium to make sure that that joint stays stable, rather than breaking. But I'm not here to be a Debbie Downer, because where a lot of the time people are under this false assumption that once we get arthritic changes, there's nothing that we can do to reverse them or stop them from happening, that's not really what the science is showing anymore. We have processes like macrophage reabsorption, which will help to reabsorb disc material even after a whiplash injury. And in a nutshell, what that says is that your body's immune system is capable of breaking down damaged disc tissue and rebuilding your disc in some capacity, as long as 1, you have enough blood flow to the area, and 2, you get enough movement to that joint that it actually flushes out some of the crud that's in there from the injury. Because so long as we keep that joint in a compromised area, your body's going to keep laying down bone to that compromised area, and then we're going to continue getting crazier and crazier bone spurs. If you could see some of the necks I've seen on x-ray, there are spikes in there that look like candy corn. And it's all because patients were never told what to do following that initial injury in order to get the weight back on the muscles and bone parts that are meant to hold a lot of the downwards pressure of gravity. And so the body did what it did best. It adapted, it reinforced a weak area, and it just reinforced it a little too well. So then how do we reset our neck? And better yet, how do we rebuild our neck, whether this is a new injury or an injury that happened 5 or 10 years ago? Happy you asked. Alright, so I'm probably a little too close to the camera, but that's not important right now because what we're going to be going over is the cervical lordosis reset. And while that sounds complicated, it's actually pretty straightforward. The only thing you're going to need is a hand towel and your neck. And what we're going to do is we're going to take that hand towel and we're going to roll it into a cylinder so that it's about 3, maybe 4 inches in diameter. And then I'm going to show you what we do from here. So all we need to do is place that towel under our neck. Neck, not head, because under the neck, that towel is going to help support the natural curve that's supposed to be in your spine. If we move it up to the head, then that forces us down into this cervical flexion, which is going to overstretch the muscles that are already tight, and it's not going to do anything to help strengthen the deep cervical flexors. And as simple as this seems, especially right after an accident, all we want to do is hang out in this position, starting at 2 minutes and eventually building up to 10 minutes to help reinforce that natural curve. Easy enough? I hope so. It doesn't get much easier than this. That being said, even once we get those cervical muscles to relax and then reteach them how to fire and hold in order to stabilize a joint, we still have questions immediately following a trauma as to where should we go for help. Do we go see a medical doctor? Do we go see a chiropractor, a physical therapist? Who's safe? Who's going to push for surgeries? Who's going to over-adjust our neck and then make the issue worse? And this is what I really don't understand about modern medicine, is because we always treat this like it's an all or nothing. You either go to the hospital or you go see a physical therapist. You go see a massage therapist, which means you can't go see a surgeon to talk about your options. Ideally, especially if this is an acute injury, you kind of want to do both, because medical doctors are fantastic for trauma. If your house is actively on fire, you don't call a carpenter to rebuild it. That's a losing battle. They're going to make it worse. You call a firefighter. And so medical doctors working on the fire, the inflammation that's currently going on through your neuromuscular system, are going to be able to prescribe anti-inflammatories, muscle relaxers, both of which are going to bring down nerve irritation and muscle inflammation so that you can actually relax and start to heal. Because in severe traumas, sometimes your body overreacts, and it gets in its own way in terms of being able to recover that soft tissue. And frankly, what I see a lot of the time at the Pittsburgh office is that people are coming in right after an injury. They're so inflamed, they're in so much pain, it's very hard for them to relax, for me to do my job. Because if somebody's already at a 10 out of 10 pain, I'm not going to be able to show them corrective exercises, massage their neck, let alone adjust their neck. So, just because I'm a chiropractor does not mean that I am 100% against the use of medications when the circumstances suggest they will be beneficial to the patient's recovery. This whole all or nothing approach is stupid. It wastes your time and it makes it harder for you to heal properly and avoid creating that arthritic environment because you didn't heal correctly. That being said, I'm not a huge fan of pharmaceuticals, so if you are looking for a more naturopathic way of bringing down swelling and inflammation, omega-3 fatty acids, turmeric, curcumin, and magnesium will all help down to, one, bring down inflammation, but also help to relax muscle spasm. A B vitamin complex will help with the nerve regenerations and making sure that they're healing properly. Types 1 and 2 collagen to help with the ligament and tendon rebuilding. And then in general, just increasing your protein intake to make sure that the muscle heals right. And if you would rather go that route, then you can go down in the description. There is a link to Designs for Health. That's the company that I use for all of my vitamins, and it should take you right to the store where I've kind of bundled this together so that you can piece them out if you just want to try certain ones or if you just want to do the whole bundle. But that will help you bring down the inflammation if you'd rather go that route versus getting a script for an anti-inflammatory. But maybe you're too cool for all of that. You don't like MDs, you don't like chiropractors, pharmaceuticals are scary, and you don't want to buy any of the stuff to help rebuild your neck. That's fine, it's your neck, not mine. But what I would like to make you aware of is that there are a bunch of free resources down in the description that you can follow a link that will help to guide you through whiplash recovery, disc herniation recovery, and things you can do to prevent early onset arthritis, whether it's stretches you shouldn't be performing, exercises you should be performing, things you can do with pillows at home to help you sleep, or your desk setup at work to make sure that we're not overstressing your neck muscles. And if you ever did break down and want to get imaging of your neck, there are resources that'll make it easier for you and your doctor to actually get the approval of your insurance company for things like x-rays or MRIs. Additionally, we have a full YouTube channel of different information that'll help you recover from currently whiplash injuries, but then down the road I'm working on cervical disc, sciatica, lumbar disc, and a bunch of other pathologies. Just give me some time, we're working on the whole thing. If you are looking for a chiropractor and you're in the Brackenridge, Pennsylvania area, feel free to stop on in, or you can schedule. That link is also down in the description. I'd love to work with you. Whiplash cases are a lot of fun because so many people are coming in here and they're worried. Oh my gosh, I'm going to have arthritis and I'm never going to be able to turn my head again. And I'm going to be that 38-year-old person who complains about their neck all the time. And it's nice that after a visit or two, they can start to see, cool, this isn't going to be the rest of my life. I can recover and get back to normal. But finally, if you're not in the area, it's just too far of a drive, but you would like to start a path to recovery today, the Whiplash Recovery module is available down in the description. It is a full practitioner-led recovery module. It lasts a little over a month where I'm going to be there with you the whole way, talking you through what I would be doing with patients in the office to help get them back to fully recovered. And I put that together just because I know that I can't be everywhere at once, but that doesn't mean that I don't want to help you. And if you're ready to go all the way from day one after that car accident to fully recovered and able to get back to your day-to-day life, check it out, because that is ideal for getting you out of pain and back to your life. And with that, thank you so much for watching. I'm Dr. Beck. Please make sure that you like this video, subscribe to the channel, because it helps YouTube know to share this video with more people so that I can help more people recover from their injuries, rather than them freaking out for the rest of their lives thinking that this arthritis is inevitable, when in reality, it's never too late to recover from an injury. And with that, I'll see you in the next video.